Hey guys, it's good to have you back for this next episode of 5 Minutes with Your Doc. Today we're going to be talking about a treatment option for submental fat reduction, and it's called Kybella. Kybella is something known as deoxycholic acid. That is the same kind of thing that your body naturally produces in the form of bile acids. And it's created in your liver, stored in your gallbladder, and eventually secreted into your duodenum to help your body dissolve fat particles into tiny manageable pieces that your intestines can then absorb for metabolism. Now, when most people think of bile, they think of nasty green and yellow sludge. That's not the case here. This is artificially created, synthetically created in a lab, and it's actually this clear liquid that gets injected into submental fat. At least that's where it's FDA approved. Now, anywhere you put this little guy, it's going to dissolve fat and fat cells. So what causes that unwanted turkey neck or submental fat deposition in the first place? Well, it's a combination of a few things. Number one, as you get older, things in your face change, things droop, fat accumulates in different places. Number two, weight gain. If you've gained quite a bit of weight, some of it's going to be deposited here. But we all know some people that have a few extra pounds, but their face and chin are chiseled, look wonderful. So there's a huge component of this that is genetic, and that's really who Kybella is for. Those individuals with just a genetic predisposition to put fat under here. Kybella is administered right in the office via a direct injection technique. The skin is first prepped and then cleansed with rubbing alcohol. A small grid is applied to allow the practitioner to inject a small amount of Kybella every centimeter in the desired treatment area. This can be repeated once a month until the desired effects have taken place. And that usually takes 3 to 6 treatments. One of the biggest fears surrounding Kybella is the almighty needle. I don't want a needle in my neck. Well, there are ways that we can reduce that. Number one, I utilize an insulin needle. And take a look at that. It's tiny. You barely feel it just as is. However, I can also apply ice for a local numbing effect, or I have topical lidocaine. It just depends on the individual and what their pain threshold is. Another one of the things that I really like about Kybella is that there are very few side effects. And in their clinical trial, there were 0 side effects that were permanent. All of them spontaneously resolved within a few months. Now, there are some immediate effects, like 96% of the patients had swelling in the area immediately after and during the next few days. When compared to placebo, which is just saline injection, 86% of the patients had immediate swelling as well. It's just a natural body reaction. Some other things you might have are some small areas of bruising where the needle went in. On rare occasions, there have been some numbness and paresthesias in the skin itself, and on even fewer occasions, less than 2%, some people had difficulty with their smile because the mental nerve was affected. Again, all spontaneously resolved. So this product is very safe. In this section, we're going to take a look at some of the individuals treated in the Kybella clinical trial. And after that, we're going to take a look at one of my patients. This first individual's name is Ponty. You can see that she's 48 years old, and this is really important. Her BMI before and after treatment remained exactly the same. She had a total of 6 treatments, and look at the amazing reduction in her submental fat. That is incredible results. The next individual is Jason. He's a 36-year-old male whose BMI also changed very little, 26.6 to 26.3, had a total of 6 treatments, and again, The definition in his jaw is much more pronounced. There's that nice 90-degree angle between the chin and the neck, and results were wonderful for him. The third individual involved in the clinical trial, her name is Jennifer, 44-year-old female. BMI stayed the same, only needed 4 treatments. Now, this last individual is one of mine, and in this image, they've only had 2 treatments. This individual has been back for a 3rd treatment and will eventually undergo a 4th treatment, and I'll update the site and give you some images on how that works out when I do my next video. But you can see already, with no significant change in BMI for this particular individual, that there is an incredible amount of definition in the jaw, and there's a huge amount of submental fat deposition that's been eliminated from this particular individual in just 2 sessions. And that wraps up this episode of 5 Minutes with Your Doc. Thanks for joining me again today. Feel free to leave comments below and look us up on our website if you want treatment, want to talk to me about direct primary care, or just want to chat. Thanks. Bye, guys.